I'm a strong believer in artificial intelligence and the potential of artificial intelligence to make a difference in medicine, diagnosis, helping us in streamlining the way that we manage disease. But in the midst of this, where are the limitations? And this is becoming more important to discuss because there is a plan that artificial intelligence can largely replace doctors in about 10 years. I think Bill Gates said it recently, and quite a number of people would agree with that kind of trajectory with regards to artificial intelligence. I suspect as well that after what has happened in COVID and the loss of trust across multiple areas of the population, they may be more open to using artificial intelligence. And so that's good. It has its advantages, but where are the limitations? So I thought of a story that I often tell other doctors, just an experience about how medicine works and how lucky we are sometimes, and how a lot of medicine is about instinct rather than fact. A very interesting fact is that you can be walking on the street and just see somebody and you know they're unwell. You can't necessarily know exactly what's wrong with them, but there is just something about how they look that makes you know they're unwell. And that comes from the experience of seeing well people all the time. And therefore, when you see someone that's unwell, you can pick it up. It's not easy to even know why you know they're unwell. You just know they're unwell. That's the instinct. So here is the case. Many years ago, while in accident and emergency or the emergency room, depending on where you were, a 26-year-old girl, she was an IV drug user and she was actively using, and she came into hospital with some lower abdominal pain. It was pretty straightforward because she also had a vaginal discharge. She would have been sexually active. She had a little bit of tenderness in her tummy, but nothing out of the ordinary. Her inflammatory markers, so her white blood cell count was a little bit elevated. Her CRP, which is another measure of inflammation, was just about 50, so not frightening. And she was very slightly anemic, which many women can be. And I remember thinking at the time that, yep, straightforward. I thought it would have been something like pelvic inflammatory disease. So she would have had an infection just around the womb in that vicinity, and she would have needed some antibiotics to get her better. As I was preparing the discharge note and her prescription, she then says to me, "Doc, I am really not feeling well. Please don't discharge me." For a young person, that's a very rare request. So that's the first red flag. Why would she want to stay in hospital? She's not that unwell. What's going on? The other thing I noticed was that she had a few beads of sweat on her forehead. It wasn't that warm. And so that again was a red flag, maybe a little bit of clamminess. I genuinely didn't know what was going on, but I was worried. I had an instinct about what she said that worried me. I couldn't get it out of my head. Why didn't she want to go home? Why did she want to stay in hospital even though she wasn't that unwell? I put this case to AI, and it flagged up one of the concerns would be that she was an IV drug user, and so they can oftentimes present in unusual ways or with complicated presentations. But it still wasn't a decision to admit her. The extra piece of information about the clamminess, if I had left that out of AI, if she had wiped her face before, if she hadn't said what she said to me, I would have missed it, and I would have missed putting it into AI, even if AI was with me. That's the piece of information that is very difficult to replicate. How do you replicate instinct? How do you replicate subtle signals from a patient that they don't even know what it is they're saying, but they are able to somehow reflect that idea to their clinician? If they were typing it in to a screen or talking to artificial intelligence, they're far less likely to be able to give those subtle cues. That's about person to person interaction. And that's where I see one of the limitations with regards to artificial intelligence. I don't know how it's going to get around that because people are people. Minute to minute, they change what they will communicate to you. And therefore, it would be the same with artificial intelligence. And it would therefore miss what was possibly a significant diagnosis. What happened to that young lady? Well, after I got the surgeons to review her, they weren't interested because she didn't have any acute abdominal problems. The recommendation from the gynecologist was to treat it as pelvic inflammatory disease, vaginal infection, and antibiotics, and discharge her home. But I couldn't because I was worried. Now, I was worried. My instinct was worried. I found a way to have her admitted under the medics. And you can imagine if anybody works in a hospital, the medics wouldn't be too happy about the fact that somebody who probably had pelvic inflammatory disease was on one of their wards. But the next night, I followed it up, and she was on intensive care. And I thought, oh my God, what happened? It turned out that she was okay the next morning. So she would have been reviewed on what we call the post-take ward round. I don't know why they didn't discharge her either. Maybe they also had an instinct. And then at about 4 in the afternoon, she crashed her blood pressure. And therefore, there was an emergency call. They did an ultrasound and they saw blood all around in her abdomen. So they took her immediately to theater. Guess what was the diagnosis? And this is where I'm saying AI, and even I look back at that. If I was in exactly the same situation, would I have done the same thing? Would I have picked it up? I don't know. But I recognized how close it was for me to have discharged her. And the same thing happened the next day, but when she was home alone, and she would have died. And that anxiety, that fear, that's what happens to doctors almost every time they discharge patients who are not quite well, but they don't have a clear reason for them to be in hospital. So please be patient with them because it's not easy. In this case, what was her diagnosis? This is a picture of a human body, so to speak, and this is the upper abdomen. So this is the liver here, and just right above it would be the diaphragm. This here is the stomach. This would be the esophagus, connecting it to the throat. And the esophagus, then the stomach would connect to the small intestine. Behind here, or this green thing here, is the gallbladder. And behind here is the aorta, so the big artery going down, which carries most of the blood supply to the abdomen and the legs. And right here is your celiac axis, which carries blood supply not only to the liver and to the stomach, but parts of the intestine as well. And it's just one of those branches of the aorta. She had what we call a mycotic aneurysm. So let me explain. So she would have had a bacteremia, circulating bacteria that infected the lining of a blood vessel. And therefore, because there was a tiny abscess in the blood vessel, the wall of the blood vessel got weaker. And if you were able to see it, if you were able to look at the celiac axis here, you would see a little bump on this here, which would represent the aneurysm, where the wall of the blood vessel was weak. She had some tummy pain before, and her hemoglobin was a little bit low because she was already leaking small amounts. but the next day it popped. And therefore, suddenly she would be spurting blood into her abdomen with no way to necessarily easily stop it. That's what happened to her. And I believe that the only reason she survived was because she was still in hospital being monitored for when this event occurred. How does AI fix that? It can't. That's the limitation. And so my suspicion is going to be that what we will have in the future is a combination where you have human experience combined with artificial intelligence to provide a system that is beyond what we have. It will be safer, it will be more effective, and hopefully cheaper. That's what I think is going to happen. And so my view is that the health system now needs to figure out how to train doctors and nurses to become AI compliant, where they know how to use it to leverage the knowledge and the skills that they already have. More than ever, I think this is critical as we move into a post-COVID period, because the diagnoses around COVID and long COVID are exceptionally complex. We're all going to need as much help as we can. Let's see how that works. Have a great evening.